Hello, and welcome to the Head and Neck Radiation Department. In this video, you'll learn about the MD Anderson Radiation Treatment Center. We'll also explain treatment side effects, when they'll start, what to expect, and how long it may take to recover. You'll also learn how to manage these side effects so that you may help prevent or lessen their severity. You'll receive a packet with all this information covered in this video. Please read it carefully and refer to it as you go through your treatment. We want to give you a brief orientation to the Head and Neck Radiation Department. Members of your healthcare team include radiation doctors, also known as radiation oncologists. They plan your treatment and help manage side effects. Medical dosimetrists develop a computerized treatment plan as directed by your doctor. Radiation therapists are trained staff who administer your radiation treatments. Radiation nurses and mid-level providers, such as physician assistants or nurse practitioners, assist the radiation oncologist with managing your care throughout your radiation treatment. Patient service coordinators assist coordinating your schedule, and dietitians provide information about foods and how much fluid you need daily. The radiation department's clinic hours are Monday through Thursday, 8:30 a.m. to 5 p.m. and Friday, 8:30 a.m. to 4 p.m. Please refer to your packet for parking information. For any appointment you have in the radiation department, please sign in at the entrance located in the main building, first floor, near elevator G. You will be directed to the designated waiting area for your appointment. In general, radiation treatments are given daily, Monday through Friday, for a period of 6 to 7 weeks. Radiation treatment takes about 15 to 45 minutes to complete. Your appointment time and length may vary day to day. If you want to change your treatment time, please speak with the radiation therapist. Only the radiation therapist can change your treatment times. Radiation treatment is similar to having a chest x-ray. Radiation is high-dosed x-rays that destroy cancer cells. After treatments, you are not radioactive, so it is okay to be around people. Having radiation to the head and neck does not affect your immune system, but try to avoid people who are sick. Once you start radiation treatment, it is important that you not miss any treatments. This will reduce the overall effectiveness of the treatment. During the 6 to 7 weeks of treatments, you'll see your radiation doctor once a week. At this visit, you'll complete an assessment form that will help your doctor manage any side effects you may be having. Please bring any medicines that you're taking for side effect management to these appointments. If you're low on medicine or need a refill, be sure to tell your doctor during your visit. If you forget to ask for a refill, you can stop by the clinic to get a prescription. However, you may have to wait. Bring snacks and drinks to these appointments in case of delays. It is important to know that even after you complete all of your radiation treatments, the radiation continues to destroy cancer cells for several weeks. To prepare for radiation treatment, you'll first go through a process called simulation, which lasts about 30 to 90 minutes. During your radiation treatment, it is extremely important that you be in the same position every time. To do this, a flexible mesh material will be molded over your head, neck, and shoulders and attached to the table. It hardens to form a mask. Once the mask is dry, you'll have a CT scan or a PET scan of your head and neck area to help the team plan your radiation treatment. After the scan, the radiation therapist will draw marks on your body. These marks help us position you correctly on the table for each treatment. Please do not wash off these marks. When you're done with simulation, your doctor will outline the areas on the CAT scan that will be treated with radiation. 1 to 2 days after you complete simulation, your doctor will review your case with a team of head and neck radiation doctors. At this appointment, the doctors will discuss your case, examine you, and make any needed adjustments to your simulation CAT scan films. Then, a medical dosimetrist will complete a computerized treatment plan using the simulation CT scans outlined by your doctor. These plans are designed to spare as much normal tissue as possible, take about 3 to 5 days to complete, and are approved by your doctor before treatment begins. When you arrive for your first treatment, you'll meet the radiation therapist. The therapist will explain how the treatment is given and ask you to lie on the treatment table. The mask that was made at simulation will be placed over your head, neck, and shoulders and attached to the treatment table. On the first day of treatment, and at least once a week, the radiation therapist will also take x-rays before radiation treatment. This is done to make sure that you are in the correct position and that the radiation is delivered as prescribed by your doctor. At your weekly radiation doctor's appointment, you will be weighed and your blood pressure will be checked. We'll also review your assessment form. Your radiation doctor will examine you, evaluate your response to treatment, and manage any side effects you may be having. Some of these side effects can be challenging both physically and emotionally, and and we're here to help you. We also have additional clinics and services to help control your side effects. The Pain Management Center and Supportive Care Clinic can help control any pain or other radiation symptoms you may be experiencing. Speech Pathology can help you with possible swallowing and/or speech problems. If you are unable to maintain your weight, the Gastrointestinal Center will evaluate you for placement of a feeding tube. And a bowel management class will help you learn how to prevent and manage bowel problems such as constipation and diarrhea. You are an important part of the team, and we will work together with you to get you through the treatment. If you have any of the following side effects and cannot manage them, do not wait until they get worse. Early intervention is key. Go to the Head and Neck Radiation Clinic right away. If another center has been helping with your side effects, please contact them directly. When you go to the Head and Neck Radiation Clinic, please complete the assessment form. You'll be seen as soon as possible by a member of your radiation team. MD Anderson's Emergency Center is open 24 hours a day, every day. If it is after hours and you have any of the following symptoms that cannot be controlled, go to the Emergency Center right away. Severe pain, nausea and vomiting, severe dehydration, severe constipation, bleeding, or a fever of 101 or higher. Now let's talk about the side effects of radiation treatment. It is important to understand that radiation only affects the tissues being treated. Side effects start mild and slowly get worse throughout your radiation treatment. Please note, how severe these side effects are can vary from person to person, even with the patients who get the same areas treated. These are some of the most common side effects related to radiation treatment. We will go through each of these so that you understand when they begin, how they will change throughout treatment, how to manage them, and the recovery time for each. Some of these side effects can be physically and emotionally overwhelming. You will get through it, and we are here to help along the way. Skin care is very important during your radiation treatment. Your skin will become dry during the first to second week of treatment. By the second to third week, your skin will look like it has a mild sunburn. During the fourth week and throughout the remainder of your treatment, the skin can break down, peel, and become moist. After you complete your radiation treatment, it may take about 3 to 5 weeks for the skin to completely heal. Follow these tips to help care for your skin. Bathe with warm water and use moisturizing soaps. Do not use hot water. Use your hands to wash the skin in the treatment area. Don't use a washcloth or a sponge because this may irritate the skin. Lightly pat the skin dry with a towel. Don't rub. Rubbing creates friction and can cause the skin to break down more quickly. It's important to keep your skin moist by using recommended lotions, creams, gels, or ointments. Start using these products on the first day of your treatment. Wash your hands before applying these ointments to your skin. Avoid any skin products that contain alcohol or perfumes. Shave with an electric razor. Do not use a razor blade, shaving cream, or aftershave. Do not wear any makeup in the treatment area because this may cause more skin irritation. Don't use a heating pad or ice pack on your skin. These can damage your skin. Avoid direct sunlight, hot tubs, and swimming pools. Wear clothes that are soft and loose fitting. If the skin breaks down, drainage may leak from the site. If this occurs, come to the Head and Neck Radiation Clinic and we'll show you how to take care of your skin. This usually includes soaking the skin 2 to 3 times a day and applying wound dressings to help absorb the drainage. After radiation is complete and your skin is healed, your skin will be permanently sensitive to the sun's rays and may burn more quickly. So we recommend using a sunscreen with an SPF of 45 or higher to protect the skin from the sun. Any hair in the treatment area with radiation can stop growing after about 4 to 6 weeks of treatment. This hair loss is usually permanent. If any part of your tongue is in the treatment area, you'll have taste changes throughout the treatment. This usually occurs during the first or second week of treatment. Foods tend to have a bland, metallic, or unpleasant taste. When you finish your treatment, your sense of taste will start to return in about 1 to 2 months and may continue to improve up to a year. Some patients get more taste back than others. Now let's talk about saliva. Saliva is responsible for cleaning the mouth and teeth. It predigests foods as we chew and lubricates foods to make swallowing easier. Unfortunately, if any of your saliva glands are in the radiation treatment area, the radiation affects the saliva glands and prevents them from doing their job. During the first or second week of radiation, you may produce less saliva. This can make chewing and swallowing solid food more difficult. During the third to fourth week, the saliva and the secretions that line the throat will become thick and sticky. small amounts of blood may be present, and this is normal. The thick secretions can make it difficult to swallow, drink, eat, and even sleep. The saliva will remain thick and sticky throughout your treatment. To help manage thick secretions and dry mouth, we recommend drinking plenty of fluids during the day. If you don't drink enough fluids, the secretions get thicker. If you're unable to drink enough fluids, we can schedule you to receive IV fluids to help keep you hydrated. Use the recipe in your packet for the baking soda and salt mixture to help loosen the secretions. Swish and gargle flat diet ginger ale. This may help break up secretions. Use a cool mist humidifier for your bedroom to help moisten the air. This can help loosen the secretions. Sleep at a 30-degree angle to help prevent gagging and possibly inhaling these secretions, which can lead to pneumonia. Ask your doctor about medicines that may help loosen or dry up the secretions. Once you're done with treatment, the thick saliva will dry up over the next 1 to 3 months. After the thick secretions have dried up, you will have a dry mouth, which is a permanent side effect. Over the next 1 to 2 years, your saliva glands may recover and produce more saliva. Some patients get more saliva back than others. An important part of mouth care is preventing infection. If any part of your mouth or throat is in the treatment area, the mouth will become acidic. This means that the pH level in your mouth is low, and this can lead to infections in the mouth. The mouth will become acidic when you begin treatment and will remain so throughout treatment and for several months after treatment. To prevent mouth infections, you must keep the mouth clean and alkaline, which means there is a normal pH level. To do this, brush and floss your teeth daily as directed by your cancer dentist. Use fluoride toothpaste or fluoride gel daily during treatment and for the rest of your life. Start using the baking soda mixture on the first day of treatment. Swish and gargle with it at least 4 to 6 times a day. Try to do this before and after meals. Rinse every day during radiation treatment and continue this routine for at least 6 months after treatment is complete. Also get your teeth cleaned by a dentist 2 to 3 times a year to remove plaque buildup, check for broken teeth, and infections. You'll need to practice good oral hygiene for the rest of your life in order to prevent tooth decay and infections. For dry mouth, use non-alcoholic mouthwash daily. Use an over-the-counter oral moisturizer to help temporarily moisten the oral cavity. Ask your doctor about medications that might help stimulate the saliva glands. Try acupuncture. Some people find it helpful. Take small bites of solid foods and chew well. You may need to wash foods down with fluids. Wet your foods with sauces or gravy. Try to chew sugarless gum or suck on sugarless candy. And keep bottled water with you at all times. If any parts of your mouth, neck, or throat are in the treatment area, you'll have some pain in these areas. You'll receive pain medication to help lessen the pain if needed. It is important to take your pain medication regularly because this will help control your pain better. Early reactions you can expect during the first 2 weeks of treatment are redness and inflammation in the mouth and throat. There is usually mild pain associated with this. During weeks 3 through 4, ulcers will likely develop in your mouth and throat, causing an increase in pain. During weeks 5 through 7, the ulcers may increase in size, causing even more pain. After your last treatment, the ulcers may continue to persist or get worse for about 1 to 2 weeks before they begin to improve. Most of these ulcers and the pain related to these ulcers will completely heal within 6 to 10 weeks after your last treatment, so hang in there. Pain medications can cause constipation, so you'll receive information on how to prevent this. It is important to keep your bowels moving on a regular basis. If you have severe constipation, you'll receive instructions on how to manage it. This usually includes the use of enemas. If your mouth, neck, or throat is in the treatment area, it'll become more and more difficult to swallow due to swelling. About halfway through treatment, you may have to avoid eating solid foods and switch to softer foods or a liquid diet. Try to eat smaller meals more often. If you experience difficulty swallowing, this can increase your risk of aspirating fluids, which means fluids go down into your lungs instead of your stomach. A speech pathologist can evaluate your risk for aspiration and teach you swallowing techniques and exercises to help decrease this risk. Once you complete treatment, the swelling in these areas will begin to improve within 2 to 4 weeks and will continue to improve over the next few months. As the swelling improves, so does your ability to swallow. Avoid the following items that can irritate the mouth and throat: tobacco products, alcoholic beverages, and any products that contain alcohol, spicy foods or foods with lots of seasoning, hot foods and liquids, acidic fruit juices such as orange juice and tomato juice, carbonated drinks, foods with sharp edges such as potato chips and pretzels, store-bought toothpaste except for those approved by your doctor, and mouthwashes with alcohol. We cannot stress how important it is to drink plenty of fluids. Dehydration means that you're not getting enough fluids. This can cause nausea and lead to severe problems. If you become dehydrated or cannot drink enough fluids, you may need IV fluids. It's also important to maintain your weight. This will help your mouth, throat, and skin heal much faster. During treatment, you'll see a dietitian who will recommend how much fluid you need daily to stay hydrated, teach you about foods that are higher in protein and calories, and tell you how much you need to eat daily to maintain your weight. Loss of appetite is another common side effect. If you're not hungry, you may have to eat smaller meals more often. Once you finish treatment and your symptoms improve, your appetite will return. If you're unable to maintain your weight, you may need a feeding tube. We usually recommend a feeding tube if you lose 10% of your weight after starting treatment. Even if you get a feeding tube, we still encourage you to swallow as much as you can by mouth. This helps keep the muscles that control swallowing strong and reduces the amount of scar tissue that you develop in these areas. The less scar tissue you develop, the better you'll be able to swallow once you've recovered from treatment. Patients who get enough fluids and are able to maintain their weight feel better during treatment and heal faster once treatment is complete. Most patients experience fatigue during treatment. It can range from mild to severe and start at any time. It usually takes about 2 to 6 months after treatment to recover from this fatigue. To help manage your fatigue, get plenty of sleep, take short naps if you're not sleeping much at night, but avoid staying in bed all day. It'll make you more tired. Do light exercise such as walking, but don't overdo it. Start with 10 or 20-minute walks 2 to 3 times a day. Radiation can cause scar tissue to form in the jaw and neck muscles. This can limit how wide you open your mouth and reduce the movement and flexibility in your neck. You may begin feeling some tightness during treatment. Often the tightness or scar tissue develops after treatment and can get worse for several months to years later. To help prevent or reduce the amount of scar tissue, please refer to the jaw and neck exercises in your packet. Begin doing these exercises as soon as you start treatment. Do them every day, 7 days a week during your radiation. And when you're done with treatment, continue doing these exercises for at least 6 months. If you do develop scar tissue, you may need to continue these exercises for the rest of your life to prevent it from getting worse. If your sinus or nose is in the treatment area, you'll have sinus congestion and bloody nostrils. You may begin to have congestion around the 2nd to 3rd week of treatment, and it'll get worse throughout treatment. Your nose may begin to bleed during the 3rd or 4th week. To help manage congestion and a bloody nose, flush the inside of your nose with an over-the-counter saline rinse several times a day to help loosen the bloody secretions. Try using an oral decongestant. It may or may not help. Don't spray any nasal decongestants on your nose. It will not help and it will burn the inside of your nose. Once you're done with treatment, your nose should stop bleeding in about 2 or 3 weeks. The congestion should begin to improve in a few weeks, but may take a few months to feel normal again. Some patients have long-term thickening of the sinuses that can cause some mild congestion. If any part of your voice box or larynx is in the treatment area, you may have some swelling. This can cause the voice to become hoarse and you may have some trouble breathing. To help manage swelling, rest your voice as much as possible. Straining your voice can make the swelling worse. Do not use any tobacco products or drink alcohol. We may prescribe steroids to help reduce the swelling. If you have swelling that causes serious problems